Hi, welcome to this episode of Patient Education for the Educated Patient. This episode, we're going to talk about whether or not an induction of labor at 39 weeks is really worth it just to prevent the risk of stillbirth. So this is in response to the ARRIVE trial. This is a very natural question that people want to know after the ARRIVE trial showed that a induction of labor at 39 weeks did not increase risks to the baby and also lowered the C-section rate. But again, medicine is not here to tell you what to do. We're moving towards a joint decision making. So it's going to be very important for you to understand the data to support whatever decision you want to make regarding you, your baby, and your pregnancy. Again, it's not for me to decide, but it's something for patients and their doctors to decide together. So let's talk about the take-home points. Stillbirth rates in the second and third trimester are very rare. That is number one and very important to understand. It's not zero, but it is very rare. The other thing to understand, which is commonly misunderstood, is that your risk of miscarriage increases after about 7 to 8 months of pregnancy. One of the common misconceptions is that your risk of stillbirth goes down until you get to your calculated due date and only starts going up after you pass your due date. But that's not true. Your risk of stillbirth is starting to increase right around 32 weeks of pregnancy. Third take-home point is that elective induction of labor between 39 weeks and 0 days and 39 weeks and 4 days would prevent about 883 stillbirths per year based on a conservative estimate. And the reason there's that 4-day range is because the ARRIVE trial had patients scheduled for induction between 39 weeks and 0 days and 39 weeks and 4 days. The numbers needed to treat when the risks of stillbirth is about 883 per year is about 1,675 elective inductions of labor in low-risk pregnancies would prevent about one stillbirth on average. So the question for you is that worth it to help minimize the chance of a very rare event? So again, this is kind of the natural response or follow-up question to the ARRIVE trial. If the ARRIVE trial demonstrates that you don't have any increased risks to the baby with an induction at 39 weeks outright, and you have a lower C-section rate, a lot of people want to know, should we just induce everybody at 39 weeks? It would also minimize the chance of stillbirth in the third trimester or in a full-term pregnancy more specifically. Let's look at the risks of stillbirth. The risk of stillbirth based on gestational age is graphed out here. And the gestational age starting at 20 weeks starts on the left side of the x-axis and at 42 weeks on the far right end of the x-axis. The risk of stillbirth is graphed on the y-axis and is measured in number of events or number of stillbirths per 1,000 pregnancies. So you can see this entire y-axis is still less than 1. So the risk of a stillbirth is very low. It's not zero, but it is very low. But your due date, your calculated due date is 40 weeks, which is right here. And a full-term pregnancy is technically 37 to 42 weeks of pregnancy. But your risk of stillbirth, again, do not only increase after your due date. They actually start increasing right around 32 weeks. So this is about 8 months of pregnancy. You can see that the risk of stillbirth starts going up long before you get to your calculated due date, which is 40 weeks. So don't let that common misconception throw you off. Your risk of stillbirth goes up long before you get to the calculated due date. This paper tried to answer that question by looking at some real numbers and some real data. And again, they wanted to know how many stillbirths would we prevent if we induced everybody between 39 weeks and 0 days and 39 weeks and 4 days. And so this is actual numbers over a 3-year period. And you can see the flow chart as they whittled people away. But in the bottom right-hand corner, you're left with pregnancies 39 weeks and above that are low risk. Remember, the ARRIVE trial was done in low risk pregnancies with no other reason for induction. If you have an indication for induction, you should probably just be induced and not fight those odds. But we're talking about purely elective inductions at 39 weeks and 0 days to about 39 weeks and 4 days. So let's blow up this corner of the graph. And you can see that they basically just took these numbers, and for the 39 weeks to 39 weeks and 6 days, they just conservatively divided this number in half and got 934.5. Then they added all the stillbirths that occur between 40 and 41 weeks, the stillbirths that occur between 41 and 42 weeks, and the number of stillbirths that occur over 42 weeks. And they got this number. So this number here, the 2,650, has to be divided by 3. And that's where you get about 883 stillbirths per year. So again, the numbers needed to treat would then be 1,675 elective inductions of labor to help prevent 1 stillbirth. And that's, again, if you induce between 39 weeks and 0 days and 39 weeks and 4 days. And the point down here is if you do a hard stop at 39 weeks and 0 days, then you would prevent a little bit more stillbirths per year in the United States. And the ARRIVE trial also said you would lower the number of C-sections by 1 for every 28 patients you induced between that 39-week and 0-day window and 39-week and 4-day window. And the ARRIVE trial showed that you would reduce the number of C-sections by 1 for every 28 patients you induced between 39 and 0 and 39 and 4 weeks of gestation in that little window. So the reason this data is published is pretty much in direct response to the ARRIVE trial. You also have to understand that in the United States, we have probably the highest infant mortality in the entire industrialized world. So that's why these questions come up, is how do we reduce that when that's such a glaring problem in the United States? Should we go as extreme as inducing everybody at 39 weeks to minimize the chance of stillbirth in our already high stillbirth rates compared to the rest of the world? In conclusion, the take-home points: number 1, stillbirth rates in the 2nd and 3rd trimester are very rare. They're not 0, but they are very rare. Number 2, stillbirth rates nadir around 7 to 8 months of pregnancy, and then they slowly but steadily start increasing. They don't just increase after your calculated due date. They actually increase way before your calculated due date. Again, if you electively induced everybody in the first half of the 39th week of pregnancy, you would prevent about 883 stillbirths per year. And the numbers needed to treat would be 1,675 pretty much purely elective inductions of labor to prevent 1 stillbirth. So again, I'm not saying that you should or shouldn't induce everybody at 39 weeks. I just wanted to objectively present the data. If you're one of these patients that is wondering, should I go ahead and induce the pregnancy at 39 weeks while I know I have a healthy baby inside my belly? Then that's something you can do. Everybody has the right to an elective induction at 39 weeks. Of course, I wouldn't make such a blanket statement. I would tailor it to the individual to see if there's any other risk factors for C-section or complications with an induction. And one of the tools that I've talked about in a different video is the induction calculator. And so sometimes you could employ that to the individual to help them make a decision whether or not induction of labor gives them the best outcomes for her, her pregnancy, and her baby. So hopefully you found that helpful. I hope to see you at the next episode of Patient Education for the Educated Patient. Until then, stay healthy and stay educated. Thank you for watching this episode of Patient Education for the Educated Patient. I hope you found this content both helpful and meaningful, and that you'll be able to use it to live a healthier life. If there's any questions, please leave them in the comments section below. I do welcome feedback, so please also leave me any comments or suggestions in the comments section. Please subscribe and turn on the notifications, and I hope to see you at the next episode. Until then, stay healthy and stay educated.